as herpes simplex keratitis, is a viral infection of the eye caused by the herpes simplex virus, HSV. HSV is a common virus that can infect various parts of the body, including the genitals, mouth, and eyes. The primary cause of herpes I is the herpes simplex virus type 1, HSV1, which is the same virus that causes cold sores on the mouth. In some cases, herpes I can also be caused by the herpes simplex virus type 2, HSV2, which is typically associated with genital herpes. Herpes I can be transmitted through direct contact with an infected person's eye secretions or through contact with contaminated objects or surfaces. People who have a weakened immune system, such as those with HIV/AIDS, are more susceptible to herpes I infections. In addition to herpes I, the herpes simplex virus can also infect other organs of the human body, including the skin, mouth, genitals, and central nervous system. Herpes infections can cause symptoms such as blisters, pain, and itching. In rare cases, herpes infections can lead to more serious complications, such as encephalitis, inflammation of the brain, or meningitis, inflammation of the lining of the brain and spinal cord. It is important to seek medical attention if you suspect that you have a herpes infection, as early diagnosis and treatment can help to prevent the spread of the virus and reduce the risk of complications. What are the generally prescribed medicines? What are the difference between herpes simplex and herpes zoster, different causes of infection sources? There are several medications prescribed for the treatment of herpes infections. These include antiviral medications such as acyclovir, valacyclovir, and famciclovir. These medications work by slowing down the replication of the virus, which can help to reduce the severity and duration of symptoms. The main difference between herpes simplex and herpes zoster is the virus that causes the infection. Herpes simplex is caused by the herpes simplex virus, while herpes zoster is caused by the varicella zoster virus. Herpes simplex is typically transmitted through direct contact with an infected person's skin or bodily fluids, such as saliva or genital secretions. It can cause symptoms such as cold sores, fever blisters, and genital herpes. Herpes zoster, also known as shingles, is a reactivation of the varicella zoster virus that causes chickenpox. It is typically characterized by a painful rash that develops on one side of the body. The virus can be transmitted through direct contact with the rash or through the air when an infected person coughs or sneezes. The causes of herpes infections can vary, but they are generally spread through contact with an infected person's skin, bodily fluids, or mucous membranes. This can include sexual contact, kissing, sharing utensils or personal items, and touching an infected area and then touching another part of the body. It is important to practice good hygiene and safe sex practices to help reduce the risk of herpes infections. If you suspect that you may have a herpes infection, it is important to seek medical attention for proper diagnosis.